For more, let's bring in Rob Shaw at the BC Legislature. Rob, this is a big deal. Walk us through some of these allegations.
Well, Stacey, 2 years after first concerns were raised right here at the legislature, the prescription safe supply was being diverted onto the streets and into the hands of organized crime. And even a year after police started making major seizures of those drugs and speaking out publicly, the Ministry of Health now confirming it is investigating what is happening, but only because of a report leaked by the opposition Conservatives. This internal presentation from ministry investigators to police warns not only of prescription drugs being resold, but also of more than 60 pharmacies suspected of billing pharmacare up to $11,000 a year in dispensing fees per patient who needs daily safe supply of drugs, and then using that money in a kickback scheme to provide illegal incentives to get more doctors and housing staff and other workers to refer more patients with prescriptions back to them. The report noting that a significant portion of the opioids being freely prescribed by doctors and pharmacists are not being consumed by their intended recipients, and that prescribed alternatives are trafficking provincially, nationally, and internationally, as well as pharmacies are offering incentives to clients to rack up those $11,000 per patient dispensing fees. Now, the health minister says the leaked report is proof that government is acting.
I want to acknowledge that we know that this is happening. These allegations are here. There's absolutely no denial of it. There's no diminishing of it. And there should be no acceptance of it. That's why we're taking the actions that we are.
Still a pretty slow response from the government. Media reports last March outlined the pharmacy concerns. At the same time, the NDP was denying the diversion of safe supply was occurring at all during debate here in the House, saying those kind of allegations stigmatized the most vulnerable. But BC forced to abandon the decriminalization program after several police busts involving gangs and prescription pills, as well as testimony from law enforcement about the scope of this problem to federal MPs. Here's the Conservative critic.
Let this be a learning experience, not only for our province, but for our country, about, how perhaps a well-intentioned program has in fact caused harm. It enriched organized crime. And, in a situation where people were meant to be helped, they were.
The Conservatives want a public inquiry in the firing of Provincial Health Officer Dr. Bonnie Henry. The NDP will never agree to either of those, in part in an inquiry because it's clear that diversion was happening right under its nose for quite some time when its ministers, Stacey, were telling the legislature that the opposite was true. Stacey?
All right, I'm sure we have not heard the last of this for certain. Thanks so much for the update on that, Rob. Appreciate it.